Hello, everyone. This is Siddharth Dambar from Chicago Arthritis and Regenerative Medicine. Welcome to our weekly live broadcast. It's September 30th, 2020. I hope everyone is doing well today. So, I've been talking more and more about connection between metabolic syndrome and osteoarthritis and joint pain as well. And so a recent article came out that I think is relevant to this and interesting. So a recent article in the Journal of Rheumatology Advanced Practitioners took a look at utilizing fish oil supplementation to reduce pain, osteoarthritis pain in older people who were overweight and obese. Super relevant because realistically, that is a significant portion of our population. And osteoarthritis in that population of folks is very high prevalence, and we need better options for them, really conservative, better options, as opposed to anti-inflammatory meds and chronic narcotics. So in this study, they specifically took about 150 people and they divided them up into a group that got fish oil, a group that got fish oil plus very low dose of curcumin, and a group that received nothing. The dosage of curcumin or turmeric that they got was really low and really not enough to really make any kind of sizable difference. But what they found was that when it came to osteoarthritis pain, that there was a significant improvement in those folks who were taking fish oil. Again, really helpful and interesting, because as we try to find other low risk options for our patients who've got chronic pain, we really want to minimize and avoid things that can cause more problems and issues. And so, number one, I really like that they were able to avoid taking anti-inflammatory medications. Personally, I recommend for over-the-counter supplements for my patients, things like, if they've got osteoarthritis pain, things like glucosamine, omega-3, turmeric. So what I like about this study is the omega-3 component, which they're getting from fish oil, really is it's a nice study to show that this makes a difference in this cohort of people that we're recommending this to. Number two is the importance of emphasizing how inflammation plays a role in the musculoskeletal system and pain, even in osteoarthritis, wear and tear arthritis. And we know that omega-3 works as an anti-inflammatory. And so the ability to work not only at a joint level, but possibly also at a systemic level in wear and tear arthritis patients, very helpful to know as well. We know that omega-3 in rheumatoid arthritis in high enough dosages, which I'll mention in a moment, is enough to help with pain, stiffness, and function. And so it's nice to find that you can get a similar benefit even in osteoarthritis as well. The other component that I think is really great is that how does this work on the metabolic system? I presented on Monday about how there's evidence that if you have metabolic syndrome, which makes you more prone to heart disease and diabetes, that there's also evidence that metabolic syndrome can actually cause cartilage breakdown, and that there's a biomarker that you can actually follow for that. We know that omega-3, because it has that anti-inflammatory component, it's appropriate for metabolic syndrome as well. That here's another way that we can look at metabolic syndrome and actually treat that, again, in a conservative way to help preserve and protect the joints as well. And so another really nice way to think about how we can connect joints, musculoskeletal issues, pain with that total body approach to treating somebody, where it's not just looking at this as a structural issue, but looking at it as a total biologic issue, biochemical issue, nutritional issue, metabolic issue, and how can you treat all those things. Great, because if you want to help somebody with pain, let's make sure we're not only thinking about, hey, you've got a fixed problem here, meaning you've got bone-on-bone arthritis. Let's think about all the variables and factors that we can actually make a difference in. I think taking that kind of positive approach makes a big difference for people as well. The last point of this was that fish oil, or omega-3 rather, you get omega-3, you can get it in a couple different things, but the two main ones that you can find it in over the counter are in fish oil supplements as well as flaxseed oil. The reality is that the majority of studies that look at the effectiveness of omega-3 when it comes to joint health are actually done utilizing fish oil. So if you're being really strict by the rules, you'd want to be using fish oil supplements. The other aspect to that is if you are someone who has nutritional avoidance, or you want to avoid fish, then flaxseed oil can give you a high dose of omega-3. But again, we don't actually know if flaxseed oil can give the same kind of results in terms of clinical response and pain relief. The last thing to note is, in this study, they utilized a total dosage of omega-3 of 2,400 milligrams. In rheumatoid arthritis studies, they utilize up to 3,000 milligrams or higher. That's a really high dosage. You're not going to be able to get that on your own just from nutritional ingestion, just from fish ingestion, unless you are an Eskimo and you're actually eating whale blubber as a condiment. You're just not going to be getting enough omega-3 on your own. So I think as an option, low risk option to treat your osteoarthritic pain-related issues and just general musculoskeletal pain-related issues, I would recommend omega-3, aiming for roughly 3,000 milligrams per day. Great. Well, thank you for your time. This one is relatively brief today, and I hope that was helpful. Send me your questions or thoughts if you have any. As a reminder, we do this on Mondays and Wednesdays, live broadcast discussing issues that are relevant to what we do here at Chicago Arthritis and Regenerative Medicine, where we focus on non-surgical management and treatment of arthritis, tendonitis, injuries, and back pain. And until next time, I hope everyone does well, has a good day, and live well. Bye-bye.